First, good morning, and first let me apologize for dragging you here on the third day of the Chinese New Year. Before I go into the press conference proper, let me just briefly introduce members of the Ministerial Task Force. The task force is co-chaired by myself and Minister Lawrence Wong. Members include Mr. Iswaran, Mr. Chan Chun Sing, Mr. Masagos Zulkifli, Mr. Ng Chi Meng, Mr. Ong Yi Kang, Mrs. Josephine Teo, Mr. Desmond Lee, Dr. Janil Puthucheary. And ministers are all here present. And if you have any specific questions relating to their respective agencies or ministries, you can pose a question to them and they will be here to answer your questions. Now, let me go into the press briefing. The Wuhan coronavirus situation is escalating globally. We saw our first case, imported case, on the 23rd of January. To date, we have confirmed 4 imported cases. Given the high volume of international travel to and through Singapore, we do expect to see more suspect and confirmed cases in time to come. The government will spare no efforts to keep Singaporeans safe. Since the start of the month, we have put in place a suite of preventive measures and have progressively stepped up our measures as the situation evolved. We have built multiple rings of defense. These include measures to reduce the risk of importation of cases at our borders, temperature monitoring for all inbound travelers on flights from China, enhanced border controls, including at the land and sea checkpoints, and expansion of travel advisories to avoid travel to the whole of Hoopa province. Our doctors and healthcare workers are also on high alert for suspect cases. The public hospitals are geared up to handle the situation and have put in place precautionary measures to screen and manage suspect cases. Once a case is confirmed, MOH will conduct contact tracing to ring-fence the case to reduce the risk of transmission. There is currently no evidence of community spread in Singapore, but we need to monitor the situation carefully. As the situation escalates globally, we need to further ramp up Singapore's measures to contain the imported cases and reduce the risk of any potential community spread. And that is why we will introduce a series of additional measures to further prevent importation of the virus to Singapore. And Minister Wong will elaborate on this later. Let me just say a few words in Mandarin. 武汉冠状病毒全球传播的情况还在发展当中。新加坡在1月23日证实有首起入境传播病例，目前一共有4起确诊病例。由于入境我国的旅客和过境旅客人数非常的多，我们可以预见下来还会有新的可疑和确诊病例。政府在保障国人安全这方面将不遗余力。自从本月初起，我们已经落实了一系列的预防措施，也根据局势的演变，逐步加强我们的防范措施。我们现有多层的防卫，包括在边境落实一些防御措施，降低病毒入境的风险。这包括检查所有从中国搭飞机入境的旅客的体温，加强我们的边境管控，包括陆地和海陆的关卡，以及把我们的旅游警示范围扩大到整个湖北省。我们的医生和医护人员对于可疑病例也保持着高度的警惕。公共医院也准备就绪应付局势，也落实了防御措施，对可疑病例进行检测和管控。一旦有确诊的病例，卫生部会积极的联系与病例有过密切接触的人，尽可能降低病毒传播的风险。目前没有证据显示病毒已经在我国社区传播开来，但随着全球局势迅速的恶化，我们有必要进一步强化我国的措施，以预防病毒在社区里传播的可能性。这也就是为什么我们将推出一系列额外的措施，进一步预防病毒入侵我国。我接着下来请黄循财部长进一步的解说我们将推出的一系列的措施。
Good morning. The government has been monitoring the situation since we first heard news of the Wuhan virus. We have a comprehensive plan in place, including contingencies for different scenarios, and we have implemented the necessary measures proactively and swiftly. This is a new virus. Not much is known about this. The situation, as all of you know, is developing rapidly with new information and news coming out of China every day. So the situation is dynamic and fluid, and we fully expect that we have to adjust and recalibrate our plans and measures over time. The key is to be able to adjust and recalibrate swiftly. And I want to assure Singaporeans that the government will do everything we can to protect Singaporeans and Singapore, but this does not mean overreacting or worse, turning xenophobic. We must be proactive and rational in our response and base our actions on the available evidence and data. And that's why we formed the Ministerial Task Force on 22nd Jan, and we met the very next day. Both Minister Gan and I met many members of the media to highlight what we have done. And at our very first meeting, we decided to step up our overall posture. We extended the travel advisory from avoiding travel to Wuhan to avoiding travel to the entire Hoopa province, and we extended checks to our land and sea checkpoints, from the airports to the land and sea checkpoints. So as Minister Gan has said today, given the worsening of the situation, the continued worsening of the situation, we have decided there is a need for a further step up in our measures. Our aim is to minimize the risk of more imported cases, to contain and isolate the identified cases, and to minimize the chances of the virus spreading within Singapore. Right, so we try to minimize the number of imported cases. We are mentally prepared that number will rise, but we try as far as possible to reduce that. And each time we detect, we contain, we isolate it, and we minimize the chances of this spreading within our own local community. That's what we are aiming to do. So what are the enhanced measures? First, we will extend travel advisory to defer all non-essential travel to the rest of China with immediate effect. We are doing this now because of the latest developments in China, which the China government itself has described as grave, and they have also said the virus is getting stronger and infections will continue to rise. Also, given Singapore's status as an international transport hub, we believe this extended travel advisory is a necessary safeguard against further spread of the virus. Second, we will enhance screening efforts at our air checkpoints. We will deploy thermal scanners at the piers of the airport to cover all incoming flights into Changi Airport. So it will not just be for flights from China, because some travelers may have transited through other countries. For inbound flights from China, we will forward deploy healthcare teams at the Aerobridges to identify passengers who look unwell, because fever may not be present for all cases. And there will be signboards clearly displayed at these Aerobridges to channel travelers who feel unwell or who have recently been to Roubaix to these healthcare teams. Additionally, we will pay attention to PRC travelers holding China passports issued in Hoopa. The numbers are coming down because of the outbound restrictions from China itself. But we will monitor closely, and ICA will pull them aside if they are holding such passports, ensure that they are well, and get them to provide all their contact details, and we will continue to keep watch when they are in Singapore. So that's our second measure. Third, we will take extra precautions for those returning from China. And we are doing this now, we are getting ready now, because we fully expect more to come back after the Chinese New Year holidays. So from Tuesday onward, from tomorrow onward, students who return from China will be given a leave of absence for 14 days so that they can stay at home and minimize close contact with others. And Minister Wong, Education Minister, will elaborate further on some of these measures. For working adults returning from China, we advise employers to collect their health and travel declarations from their workers and ensure that they monitor the temperatures daily and see the doctor immediately if they have any symptoms. On top of that, on top of this basic requirement, we will need differentiated measures for different sectors in order to protect the well-being of Singaporeans and also ensure business continuity. So we are deploying a differentiated strategy, and for sectors where there is close and sustained contact with vulnerable groups, including children and the elderly, the employers should institute 14 days leave of absence for their returning workers from the day of return. We have identified 3 sectors where this will apply: in healthcare, education, and elder care. And we will put this measure in place for all government-operated and government-funded entities in these 3 sectors. For the private employers, the relevant government agencies will be following up with them to get these measures implemented. For the other sectors, we would strongly advise employers to keep a close watch over their returning workers and take a risk-based approach depending on the nature of the work. For example, some can arrange for telecommuting to allow their returning employees to work from home first. In fact, our public transport companies have decided to temporarily deploy bus drivers returning from China to non-public-facing jobs for some time until after the incubation period. So there can be different ways to manage the risk, and government agencies will work with the respective business representatives and industry associations to take the appropriate measures, and Minister Chan will also touch on this later on. So these are 3 major moves we are making now. They are appropriate and necessary to protect ourselves. These will not be the end of the measures we make. We will continue to monitor the rapidly evolving situation. As I said just now, it is dynamic and fluid, and we will implement additional measures as necessary. We have no evidence yet of community spread in Singapore. We have no evidence that there is community spread of this virus in Singapore, but it may happen. And if it does, we stand ready to take additional measures. As I said before, and Minister Gan said earlier too, we are putting in place many layers of defense to protect ourselves and to protect Singapore. And the most important defense is still at the individual level. To beat the virus, it is not enough for the government alone to act. Singaporeans must do their part too. Be socially responsible. See a doctor if you are sick, or wear a mask if you are ill to protect those around you, including your family members and loved ones. Practice good personal hygiene. Washing your hands frequently is of utmost importance to minimize the possibility of picking up the virus. It's also important to stay calm and to carry on with our lives. We do not know how long this will last, but let us not fall prey to false rumors or succumb to panic. Let us not be afraid. In terms of information, refer to MOH website and the government.sg WhatsApp for official updates on the latest situation, and we will do everything we can to put out information accurately and in a timely manner so that Singaporeans have access to this information, and Minister Iswaran will also touch on this later. So all in all, we have our plans in place. We have to be psychologically prepared and to overcome this particular issue. We've confronted many challenges before. We've defeated SARS. So we can and we will overcome this together. So my colleagues now will provide some additional details on their respective areas.
Now I invite Minister Ong Ye Kung to talk about both the education sector as well as the preschool sector.
Thank you. I know many of us worked through the Chinese New Year period on this issue, so I wish everyone happy and healthy Chinese New Year. Let me just start with a recap. I'll talk about the education system. Recap, on the 23rd of January, a few days ago, we instituted travel declarations for all our schools as well as our higher education institutions. And all trips, we didn't have any trips to China for the month of February, but there were some in March. So schools, IHLs is Institute of Higher Learning. I'll just use the short form from here. IHL, they have either cancelled or postponed those trips. So we have no trips until end of March, and then we will monitor the situation. And then students who are already in China, the IHLs are in the process of recalling them back. So all this, and at the same time, throughout all our institutions, we are reminding everybody to practice good hygiene. We have a parents' gateway now, so we can pump up to parents and students. So all this was done 23rd January. So today I'll talk about additional measures that Minister Lawrence Wong talked about. So as we know, next few days, we enter a sensitive period. As Minister Lawrence Wong said, we want to minimize the risk of more imported cases. And so post-Chinese New Year, school reopen, and then we want to manage this risk as students start coming back. And some have gone to China. So we want to especially take initiatives and measures to protect the young ones. Okay. So let me just talk about the numbers, because we instituted travel declarations earlier. So we got some sense of the numbers of students who has gone to China in the past 14 days. So let's look at school numbers. School means from primary school all the way to JC. Preschool, I'll leave it to Minister Desmond Lee later to say something about it. Yeah. So for school, primary school all the way to JC, we have 2 who has gone to the province of Hoopa. 1 student, 1 staff in the last 14 days, 2. As for those who went to the rest of mainland China, as of now, we have about 712 students, 62 staff who has gone to China in the last 14 days. Polytechnics and ITE, they are all part of the MOE system. These are our statutory boards. So we have 3 who has, for the last 14 days, gone to province of Hubei. And then 107 students gone to the rest of mainland China, 6 staff gone to the rest of mainland China. So all in all, we are looking at 5 persons who have been to Hubei in the last 14 years, and about, 14 days, what am I talking about? 14 years include me. 14 days, been to Hubei. As for rest of mainland China, we are looking about 800, almost 900. So all in all, it is 892 persons so far. We do expect the numbers to go up as travel declarations are still coming in. Yeah, but we are looking at that kind of numbers. So it's actually a fairly manageable number. Imagine we have 344 schools. You just look at the school numbers, 344 schools. We are looking at, on average, 2-3 students per school. Some may have higher, some may have 10 students. So I think we are in a situation very different from Hong Kong. Some of you will probably be asking me that. Hong Kong is part of China. I think their numbers are not like this. Their numbers will probably run into thousands or tens of thousands. So for us, less than 1,000, I think we can manage it much better. So school will reopen. School will reopen. IT, Polytechnic will open, and AU stand for Autonomous Universities, they will open tomorrow. Schools, primary school onwards to JC, open on Wednesday. But what we will institute is that for those who have been to China in the last 14 days, we will implement a leave of absence. So they will stay at home for 14 days from the day they arrive. Yeah. So how this translates is that for IT and Poly, if you've been to China and you arrive in Singapore on or after 14th of January, you stay home for 14 days from the date of your arrival. The date of your arrival is day 0. The next day is day 1. Up to 14 days, that's the incubation period, and then you can come back. Yeah. So this is to minimize your exposure. Should you, unfortunately, contact the virus while in China, minimize your exposure to young children. Yeah. And for those school students, if you have been to China and arrive in Singapore on or after 15th of January, you also stay home 14 days from the day you arrive. Why is there a day difference between the two? Because the school opening is a day difference. Yeah. So we are calculating 14 days. Basically, that's the basis. Yep. And of course, there are also other students, other private institutions. So for international schools, once after this press conference, we'll be contacting them and discussing with them and basically advising them to follow the same protocol. Yeah, I don't expect any disagreement. Autonomous universities, as you know, they are autonomous, so we are also advising them, and we've been discussing with them to implement the same measures. They have all agreed, and they will all be implementing the same. Yeah. Now, one last thing before I sign off is that for students who are on leave of absence, this is not an extended holiday. We will support your learning and education during these 14 days. Good thing we have done, all our syllabus and curriculum is now online in the system called SLS, Student Learning Space. So as the numbers are not big per school, teachers will make the extra effort to reach out to them, support them, so that they can catch up with the lessons at home using SLS. So this is not 14 days of just play at home, yeah. So we'll work together with parents, students, and I think this is a necessary precaution during this period, which is these few days which are sensitive. Thank you.
Thank you. Now I ask Minister Joanne to talk about communication approach and management of information. Thank you.
Thank you. First, I want to thank you, all members of the media, for coming down to this press conference at short notice on this public holiday. In a situation like that we are in now, the flow of information can help to inform, educate, and build trust. But it can also be abused to spread falsehoods and create anxiety, alarm, and panic. We are witnessing this in the case of the Wuhan coronavirus, with information and falsehoods being circulated online. Last night, the Ministry of Health issued a general correction direction to Hardware Zone to correct a falsehood claiming that there had been a death in Singapore as a result of the new virus. Even though the post was eventually taken down, more than 4,600 unique visitors had viewed the post in the 2.5 hours it was up. Some who viewed the post would also have shared it with others and been misled by it. The Minister for Health had ascertained that there was a false statement of fact and was satisfied that it was in the public interest to issue the correction direction. We must take swift action against such falsehoods. Otherwise, there is a grave risk that they will spread and cause panic amongst our citizens. And that is why we have POFMA, and we will not hesitate to use the powers under the law to take action against any party that spreads such falsehoods. As Minister Lawrence Wong said, we have also intensified our efforts to provide our citizens with accurate and up-to-date information on the Wuhan coronavirus situation in Singapore. Our aim is to keep Singaporeans informed of the facts so that they can safely navigate the online terrain, discern truth from falsehood, and know what you can do to lessen the risk to you and your family. MCI is working closely with MOH to regularly share with our citizens important public information through multiple channels, such as the Ministry of Health website, gov.sg website, Facebook, Instagram, WhatsApp, and Factually. We are also using the broadcast media and digital display panels in HDB estates to reach out to all segments of our society. In particular, we have extended the use of the gov.sg WhatsApp to disseminate updates and address misinformation and falsehoods about the Wuhan coronavirus. The response from Singaporeans has been overwhelming, with more than 56,000 new subscribers signing up for the service since Sunday. Because of this sudden surge in demand, some may have experienced delays when subscribing to the service. We seek your understanding and are actively working with Facebook and WhatsApp on technical solutions. But I would like to assure all Singaporeans that you can get the same up-to-date information through the multiple alternative platforms that I have listed. Finally, the situation is fluid, and we need the help and cooperation of the media, all Singaporeans and residents in this critical national effort to prevent misinformation and falsehoods about the Wuhan coronavirus from sowing fear and causing panic in our society. Please rely on information only from trusted sources. Verify the information you get from various sources before sharing it with family and friends, and report any suspected falsehoods to info@pofmaoffice.gov.sg. Above all, we urge everyone to please keep calm, get the facts, take appropriate precautions, and stay vigilant.
Thank you. I'll now call upon Minister Chan Chun Sing to talk about the business sector, as well as to talk about the support from the community organizations, from the People's Association organizations.
Thank you, Kim Yong. Let me first start with the economy before I touch on the community sector. From MTI's perspective, we certainly expect there to be an impact on our economy, business and consumer confidence this year, especially as the situation is expected to persist for some time. Of immediate concern will be the tourism-related sectors. These include our travel agents, hospitality industries, F&B, retail, and air transport. As in the previous episodes like SARS, our measures to help our businesses and enterprise can include reducing the business costs, elevating their cash flows, and the retention of their workers. MTI and the Trade Association Chambers are working closely now to develop the necessary support measures for our economies and our workers. I would like to assure Singaporeans that the government has the means, and we stand ready to work with our trade associations, Ministry of Manpower, and our labor movement, Ntuc, to make sure that we have the support measures for enterprises and workers. Since the outbreak of this situation, our economic agencies, in particular Singapore Tourism Board, has been in contact with our trade associations and business chambers to manage the impact and to assess the help necessary. Our priority now is to work closely with MOM and Ntuc to mitigate the fallout and support our workers affected to preserve their livelihoods. At this point in time, I also like to encourage our enterprises to refresh their business continuity plans if they have not already done so. For the longer term, we will press on with our industry and market diversification plans to strengthen our resilience as an economic system. Now let me touch briefly on the People's Association community activities. Similar to our response to SARS and the haze, our community network and partners stand ready now to do three things. First, we have in place the community support network to take care of the vulnerable in our community. This, in particular, refers to those who are elderly, the disabled, and the young. Second, I must also take this opportunity to thank the community network and partners who have worked tirelessly over the holiday season to provide us immediate feedback on the areas of concerns that are affecting our people in Singapore. And with their speedy feedback and responses, we have been able to fine-tune our communications plan together with the Ministry of Communications and Information, MCI, to push out relevant informations to dispel rumors and counter falsehood. And we will continue to do the third thing, using our ground network to make sure that we work closely with MCI to combat rumors and fake news. Because in the fight against a situation like this, it is not just a fight on the medical front, it is also a fight on the psychological front. We must make sure that we provide assurance to our people. While we stay alert, we must not panic, as what Minister Lawrence Wong have mentioned. Our current assessment is that the community events can continue to proceed with enhanced measures. We will take reference from MOH and the national guidelines, as has been explained by Minister Lawrence Wong. Large-scale community events like Changi and River Hongpao will adopt and has adopted enhanced measures for temperature screening and deployment of additional medical staff to render assistance as necessary. All contractors, volunteers, local and overseas performers will also adhere to the latest MOH guidelines. And as Minister Lawrence Wong have said, we advise people who are not feeling well to seek medical help quickly and avoid participation in activities where there are large crowds. But most importantly, we encourage everyone to take personal hygiene measures to safeguard their own well-being. So this will require a collective effort, but from our experience through SARS and the haze crisis, we are confident that we have the basic network to allow us to get through this as a country. But we will continue to strengthen our measures, adapt those measures as necessary given the evolving situation. Thank you.
Thank you. I'll ask Minister Desmond Lee to explain the measures in the preschools.
Good morning, colleagues and friends. Our children and our infants are vulnerable to infectious diseases. We have to take steps to protect the preschool community, especially our infants and children. Last week, the Early Childhood Development Agency, ECDA, issued advisories to the preschool sector and to parents. First, on the deferral of non-essential travel to Wuhan and then later to Roubaix. Staff returning to preschools from affected areas were to wear masks and to be deployed back room away from interface with children and infants for up to 2 weeks. And we instituted the travel advisory. Tomorrow, our childcare centres reopen, about 1,500 childcare centres, and the day after, on Wednesday, about 400 kindergartens will reopen. With the evolving situation of this coronavirus, we will be taking further enhanced steps as a precautionary measure to protect the preschool sector, especially the children and infants. At about 9 a.m. this morning, ECDA issued an advisory to our preschools, essentially to put in place a leave of absence for preschool staff as well as preschool children who have returned or will be returning from China. It is similar to what the Ministry of Education is instituting. So children and staff who are returning on the 28th of January to Singapore from China will take 14 days leave of absence from school, preschool, and return on the 12th of February. For preschool staff and children who had returned on the 14th of January, you count 14 days and they return on the 29th of January. These are precautionary measures intended to safeguard the infants and children and staff of preschools, and the parents are advised to monitor their children and themselves and seek medical assistance if they feel unwell. In terms of figures, we have, as I said, about 1,900 preschool centres in Singapore. We have 25,000 teaching and program staff, approximately. And as of today, our early estimates are that some 500 to 600 preschool teachers had gone or have returned from China for various reasons, like study trips, personal vacations, and so on. And of 180,000 preschool children in Singapore, our early estimates from our operators are that around 1,000 children would have gone or returned to China. So that is the magnitude. We believe it is manageable, and we are closely working with some 400 preschool operators to make sure that this is smoothly managed. EGDA, as well as MSF colleagues, will be visiting various preschools to check on implementation and provide support to the sector. We are doing likewise for social services that have sustained interface and engagement with more vulnerable communities like children and the elderly. So for example, disability activity centers, our EPIC centers that provide early intervention support for preschool age children with disability, our family service centers, our SSOs, and so on, will also put in place the leave of absence system for staff who have returned or are returning from China. And likewise, we work closely with our partners from the social service agencies to put these measures in place. Now, all these measures will cause inconvenience to parents, to preschoolers, to families, to our operators, teachers, and the social service agencies, and I apologize for the inconvenience caused and seek their support to work together with us to put in place these enhanced precautionary measures. Thank you.
Thank you, Desmond. I'm confident that if we work together, we'll be able to contain the situation. Government is taking decisive steps to protect Singaporeans. The private and the people sectors need to work together with us on this as well. At the individual level, every Singaporean can play our part by staying vigilant and adopting good personal hygiene practices at all times. The situation is rapidly evolving. We are closely monitoring what is happening and will institute more stringent measures as needed. We expect to see more suspect cases and even confirmed cases in time to come, not just in Singapore, but also globally. I urge Singaporeans to remain calm and stay vigilant. Ultimately, a strong national response requires a whole-of-nation effort. Thank you. Before I open to the ground, let me say a few words in Mandarin to wrap up. 我相信，只要我们全国能够上下齐心，必定能够成功地控制局势。政府果断地采取了几样措施来保护新加坡人，个人和企业领域和民间组织也必须和我们携手合作。在个人方面，每一个国人也能够尽我们自己的本分，包括随时提高警惕，也保持良好的个人卫生习惯。目前的局势正在迅速的发展，我们必须紧密观察最新的局势，在必要的时候调整我们的应对政策。我们必须做好准备，因为下来不止在新加坡，而是在全球各地，可能都会发现更多的可疑和确诊病例。我呼吁新加坡，我们国人要保持冷静，保持警惕。毕竟要全国能够强有力的应对这样的一个局势，我们还是需要全国上下一心，一起来努力。谢谢大家。Now I'll open the floor to questions. Someone? Use the mic.
Okay, sorry. I'm Salma Khalid from the Straits Times. Japan is repatriating all its nationals from Roubaix. Is Singapore planning to do a similar thing?
Thank you. I'll ask Janil, who's representing Ministry of Transport, to elaborate.
We're in touch with the Singaporeans that are there, and we're working with both the Chinese authorities as well as our MFA staff. And we have staff there and our MFA teams that are here to explore what can be done, and we'll give updates when we have some clarity on the situation.
What stage are you at right now? You say you're discussing.
We need to work through the Chinese authorities. I mean, there are difficulties that they're facing on the ground, and we have to make sure that we don't add to their burden in terms of insisting on a particular position. But we're in touch with all the Singaporeans and working also with the airline companies, and we'll have more updates once we know exactly what we're going to be doing with the situation.
Thank you, Radna from Reuters News. Just to double check, this leave of absence for school children and staff, as well as some of the sectors that you've identified, that's healthcare, education, elder care, this is absolutely compulsory?
We'll ask Mr. Ong.
It's a leave of absence, it's an advisory. Compulsory, I assume you meant if you don't do it, it's illegal. Yeah. So that is provided under the law if we issue a stay-home order for quarantine. Yeah. So we need to differentiate between the two. Quarantine is when you do contact tracing, someone confirmed case, who has he come into contact with, we contact them, there's a stay-home order, they are quarantined for 14 days. Here, I think we are looking at people who are just come back from China. Yeah, China is 1.4 billion people. Yeah, but this group came back from China. You just want to manage the risk of not importing more cases. So it's quite different from contact tracing and quarantine. It's a different category altogether. So we're just taking precaution, ask them not to attend classes, not to go to school, where there's sustained and close contact with so many students. So this is more an advisory. Having said that, the big bulk, schools, MOE, kindergarten, secondary school, JCs, IT, poly, they are all part of MOE. So as an organization, we will be able to enforce it. Yeah. As for preschool, private institutions, they are regulated by us. So in a way, we also have regulatory levers to ensure that they comply by it. So I think we will most likely have a very high level of compliance.
Right, so it's still an advice as opposed to an order.
Yeah, it's not an illegal thing if you don't.
But just to add also to what Min Ong have said, in these three sectors, on top of the MOE sectors, healthcare and elder care are largely under MOH and MSF to some extent. And these, a lot of the entities there are government run or government funded. So we believe we are able to move on these entities. For the rest who are private employers, as I mentioned just now, the government agencies will follow up with them, and I believe and I'm confident that as responsible employers, they will also do their part.
Right. The next question I had was about suspending travelers from Hubei. As of now, I see that you've mentioned that there's going to be additional screening at the airports for such travelers. Are there any plans to suspend any travelers from that region? And last question was on your advice to defer travel to China. Is this just non-essential travel or all travel?
It is non-essential travel, so that's the advisory for non-essential travel to China. On travelers coming out from China, particularly from the Hubei province, there are already outbound restrictions from China itself. Right? So as I mentioned, the numbers are coming down already. And on top of that, I mentioned we are doing additional checks. We will look at the passports, we will pull them aside, and we will make sure that they are in good health and continue to monitor their status when they are in Singapore. We will be proactive, but I don't think we should be overreactive. As I said earlier, our actions will be guided by data, by evidence, and also by international guidelines set by the WHO on how to deal with such contingencies. And so we are taking the necessary steps, but we do not rule out further actions because the situation is fluid and things may escalate, and if it does so, we stand ready to put in place stricter measures.
Hiai from Zaobao here. I have two questions. So the first one, how much budget is the government going to set aside to fight this war against Wuhan pneumonia? Second question, so I understand that our DORSCON level currently is at yellow level, so why yellow and not heighten it to orange? I understand that Hong Kong has already escalated to an emergency level. Yeah.
I think our focus now should be to look at what are the appropriate measures that we will need to protect ourselves and also subsequently to support businesses and the economy. Right? So that's our starting point. As I've said before, we will marshal all available resources to tackle this situation. And that means looking at all appropriate measures to defend and protect ourselves now. And then subsequently, as Minister Chan talked about, we are also looking at the need to help businesses to support the economy, to help vulnerable groups. Right? So these are all areas that we are working on, and where necessary, we will ensure that additional measures will be put in place.
Let me just elaborate on the DOSCON. I may ask my colleagues on the professional side to elaborate, but very briefly, each country have their own alert framework. Ours is quite different from Hong Kong, and we are currently at the yellow DOSCON level. And within the yellow DOSCON level, there were different levels of measures that were introduced. And some of the measures that we're introducing are beyond the yellow DOSCON, because these are some of the more preventive measures. And at the end of the day, we will need to assess the situation and to introduce measures as appropriate to the situation. And for DOSCON will help us, DOSCON framework will help us to coordinate whole of government agencies so that they are aware of what are the necessary measures to put in place. But in fact, some of the measures that we're introducing, we have introduced before and we're introducing today, have gone beyond what the yellow DOSCON requires. But as a general rule, today we remain at the DOSCON yellow. So maybe Kenneth would like to elaborate.
Thank you, Minister. At this point in time, the DOSCON level remains at yellow. This is our risk assessment for what the situation is in Singapore. I'd like to reaffirm that we do not have any evidence of sustained or, in fact, any community spread of this infection in Singapore. And as a result, we don't think there's a need at this time to change our DOSCON status. We continue to be vigilant, and if needed, we will adjust that status accordingly.
Just wanted to confirm that whether the Amir from Bloomberg News wanted to confirm whether the number still stands at 4, the recent update. And other question would be like, is there a plan if the virus spreads, God forbid it doesn't, but still, to come up with isolation or quarantine centers like other places have done before?
The number still stands at 4 as of today. So that's, and whenever there are updates, as we have done, we will continue to provide updates to the media and to Singaporeans. Will the situation get worse? As I mentioned earlier, we do expect the situation to be very dynamic and fluid. The Chinese side have already said that they expect numbers to rise, more infections. We will do everything we can to minimize more imported cases, to isolate the ones we've identified, and to minimize the risk of a spread of the virus within the community itself. That's our strategy and that's our objective. But we stand ready if there is indeed a community spread within Singapore. We stand ready with additional measures, including the ones you highlighted, whatever we need to do to ensure that Singaporeans are safe. So we have a suite of contingency plans in place. We have done it before in SARS, and we are prepared and ready to roll out additional measures, to marshal resources and additional budgets, as was asked earlier, to ensure that we overcome this situation.
Hi, Xinghui, South China Morning Post. I have 2 questions. Do we have any idea of how many passengers have come from Hoopaix or from China within this period? And then the second question, there was an Economist Intelligence Unit report in October that said that Singapore is not fully prepared for a major infectious disease and ranked us behind Malaysia and Thailand. So just wondering if that's something you've seen and if you have a response to that.
On the travelers from Hubei province, as I said earlier, there are already restrictions from China itself, right? So that numbers have come down already. You can't rule out the fact that somebody may be holding a China passport issued from Hubei coming through other cities from China. And that's why in our airport checks, ICA is not just looking at where this person is from, but looking at the passport, and we'll pull them out. If necessary, when we see these passports, we will screen them more thoroughly, we'll get their contact details, and we will monitor their status during their stay in Singapore. Right? So that's what we are doing to ensure that the measures are in place to avoid and minimize the chances of more imported cases.
With regard to the preparedness, I'll ask my colleague Kenneth to elaborate again. We have just completed, in fact, some time ago, a joint inspection by the WHO team to certify that we are ready. So I think Kenneth can elaborate.
Thank you very much, Minister. The Economic Intelligence Unit's report is something that we're familiar with. The methodology for the report is on the basis of open source domain information and does not take into account other sources of information which in fact paints a better picture of what our state of readiness is. Minister has alluded to the fact that in fact the World Health Organization has visited us, inspected our facilities, and also we've been sharing what our plans and processes are. They've in fact been happy with our state of readiness, and they are confident that we have a robust system in place to deal with pandemics and infectious outbreaks. We remain confident that we will be on top of things, and we will continue to adjust our plans as needed.
I must also say that we cannot afford to be complacent. Whether we are prepared or not, whether other people say that we are prepared or not, we need to continue to improve our readiness, our capability. And we just recently opened NCID, and the director is here. If you have any question, you can ask her. And I think we are quietly confident, but we mustn't be overconfident, and we always want to learn from others, and we always keep our eyes open, keep our ears on the ground to better understand what is evolving. And I always remind our healthcare workers, our healthcare leaders, that every virus is a new virus, and there will be new challenges, new unknowns, and we mustn't assume that we know everything, and we continue to improve ourselves as we go along.
I'm from China Radio International. My question is, how do you evaluate China's work against the virus and information sharing with Singapore government? Thank you.
I think it's very clear to all parties that China is going all out to overcome this crisis that they are facing and to minimize the spread of the virus outside of China. They have put in place very stringent and rigorous measures, right? And quite swiftly too. Another thing that we have the benefit of, unlike SARS, is now we have much faster, thanks to the work of the Chinese, the genome sequencing of the virus. Unlike SARS, where it took us quite a while to have that information. So with that information at hand, today, we are able to detect the virus, and we can do it in a matter of hours. So this is critical, because once somebody reports symptoms, goes to see a doctor, we are able to detect, contain the situation, and isolate the spread of the virus. Isolate it and manage the spread of the virus. So that's very useful from our perspective. So we have links with the Chinese authorities. We are working very closely with them, and we certainly wish them all the very best in overcoming this present situation.
Maybe at this juncture, I would like to invite Minister Josephine Teo to talk about management of our workers, and following that, Minister Ng Chee Meng will talk about the support for the workers.
Thank you very much. You've heard about the additional precautionary measures that were outlined by Minister Lawrence Wong. Life must go on. Businesses must be able to continue operating, and our workers must be able to keep going to work. Now, we have a workforce of 3.4 million, and also about 150,000 employers. And the tripartite partners in Singapore, meaning the government, the employers, as well as the labor movement, we have been working very closely together to help keep all of our workplaces safe. Minister Ng Chee Meng, who is also Secretary General of the NTUC, will say more about the measures on the part of the workers, for me, I would like to emphasize the very important role that our 150,000 or so employers play in keeping the workplaces safe. Now, what should employers do in this situation? First, employers should familiarize themselves with all of the advisories that are being issued and being updated all the time. Minister Ishwaran had outlined the channels through which they can be familiarized and updated. This, of course, include the Ministry of Health as well as the Ministry of Manpower websites, as well as gov.sg WhatsApp subscription, which I think is useful for all the employers. Second, apart from familiarizing themselves with the updated advisories, we would like the employers to also be responsible in implementing the recommended measures without delay. So implement the recommended measures without delay and play your part as a responsible employer to keep workplaces safe. Third, which is also important because the situation is still evolving, tell Ministry of Manpower if you have reasons for concerns and if you need further advice on what to do or are unsure about anything at all. We will work with our tripartite partners, the Employers Federation, as well as the labour movement to advise you accordingly. So familiarize yourself, implement the recommended measures, and tell MOM if you have reasons for concerns. These are the three things that I would like all employers to pay attention to and to help keep our workplaces safe. Thank you.
Well, NTUC is working hard together with the government and the employers to implement the different measures on the ground, whether it is across the transport sector, the hospitality sector, including our healthcare workers in the hospitals. We are working through our unions to make sure that workers are well taken care of. In NTUC, workers' welfare is a key priority, especially in such circumstances. So we have taken proactive measures with different companies in the private sector and with government agencies to make sure that different measures that the ministers have mentioned are implemented on the ground. So to take that step further, Minister Josephine, myself, and Singapore National Employers Federation is also working on a tripartite advisory on business continuity and workers' welfare so that these measures can be disseminated in good time. But lastly, regardless of the different measures that the government may be taking, as Labour Chief, I would urge all workers, ordinary Singaporeans, to take personal charge of their own health. Make sure that you keep abreast of different government advisories. Importantly, take charge of your own personal hygiene so that you minimize infection. And most importantly, where needed, as a frontline staff, take the necessary precautions so that individually we are well and collectively companies can continue with the different things that they do and keep life as normal as possible for Singapore and for Singaporeans. Thank you.
Maybe the gentleman.
Hi, Gwyneth from CNA. Two questions. One is a travel website in China said that over 10,000 passengers had arrived from Wuhan from the period 31st December to 22nd January. Does the government have this information and can it confirm? Also, would you be able to check the passport information, the stamps that have been issued, so that even if they are not from even if the passports are not issued from Roubaix, if the passenger has gone through Roubaix in the past 14 days, for example, that would be, is that part of the measures that ICA will be taking as well? Secondly, what are will there be measures in the upcoming budget to mitigate the impact on businesses, considering that the situation will last for a few months? And I'm going to pass it to Cheryl, my colleague.
I just have one more question in terms of, are the measures also in response to some news that the incubation period, the virus can be spread during the incubation period, or are we just looking at these measures as a whole? Thank you.
On the first question, we are aware that there are travelers who have been to Hubei province and who would have come to Singapore and may still be in Singapore before the flight restrictions were put in place. These need not only be China nationals. There could be Singaporeans, there could be people from other nationalities who had visited Hubei, Wuhan, or any other city in Hubei province, and then are back here in Singapore now. So we are reaching out to all of them. I can't give you a specific figure yet because the operation is underway even as we speak. Some of them would have left already, right? And so we are reaching out, contacting them to make sure that they are safe, that they are in good health, that if they show symptoms, immediately report to the doctor, and monitoring their status. So we'll provide an update on this in due course. Number two, on whether additional measures will be put in place, and particularly for the budget. As I mentioned earlier, I don't want to preempt what is going to be in the budget, and this is not, I think the forum for this, but we are very mindful that on top of all the defensive measures, the multiple layers of defense that we are talking about and that we have put in place and will continue to enhance as the situation evolves, there will be different groups who may need support and help. That will include specific areas of the economy which will be impacted, and I think will feel greater impact when the travel restrictions start to bite. So retail, tourism, these will be impacted. So we are monitoring these very carefully, working together with our economic agencies. And if need be, we will certainly respond, be it in the budget or as an off-budget package, right? So we will make sure that we have resources available to help support our businesses, vulnerable groups, as well as the economy. Thirdly, on the incubation period and reports that it is possible for the virus to spread before you show symptoms. We've seen the reports. We are in consultation with our medical experts on what the evidence for this is, right? Because I think this is still quite preliminary, and it's not, from my understanding, and we can get the medical experts to say a little bit more later, that it's not conclusive yet, right? But it certainly is something we are watching out for, because if indeed this is happening, then certainly we will have to do more and escalate our measures even further. But perhaps our Kenneth would like to say something?
We are mindful of the developments that have been coming out from China and the news of how transmissible this virus is. The information continues to evolve. We've met up with our own public health experts and infectious disease experts. Our assessment is the information still continues to evolve, and it's not conclusive enough for us to make immediate changes to our current posture in terms of the measures that we're doing. However, our assessment, in fact, is that the measures we've undertaken and plan to implement over the next few days remains appropriate, ready, and reasonable for the situation as we see it now. Just to affirm one more time, there's no signs of any community spread in the country, and we continue to track and look very closely for any evidence of that occurring. We are continuing to get more information from internationally, together with our colleagues in China and from the WHO. And as the information comes in, more information is made available to us. We will continue to review the suite of measures we put in place, and that would include reviewing our case definitions, our quarantine measures, our contact tracing and testing measures as well.
So just to reiterate, the measures and plans that we have, as I said earlier, our posture is to be proactive, is to anticipate and move as swiftly as we can, but whatever action we take really has to be based on evidence, data, international medical guidelines. I don't think we want to be, on the basis of one report, two reports, not even sure if it's conclusive, we overreact and we overdo things. That's not the Singapore way. we stay calm, we have contingency plans in place for all scenarios, and if the need arises, we will escalate, we will put in place tighter, stricter measures. And we stand ready to do that, including sparing no effort to get resources and budgets and fiscal resources that will be needed to support these plans.
Let me ask Minister Masagos to talk about environmental issues.
Good morning. Our primary focus will be on cleanup exercise after incidents, after these incidences, so that the premises are well disinfected as well as properly cleaned. There's already, we have worked with MOH as well as the NCID to come up with the guidelines, what kind of substances to use, what kind of surfaces they should target, how often they should be doing it, and at the same time, the protection that the cleaners themselves must take. In addition to that, what to do with the materials that they use, the cloth, the cleaning materials that they use, how to dispose of it properly. In Singapore, we already have facilities to dispose of biohazards. So these are part of what we have to do to all these premises owners and the cleaners need to comply with. At the same time, we have also geared up at least 2 companies for now. If these premise owners do not know how to do it or would like someone more professional to do it themselves. But in any case, when MOH has directed for premises to be disinfected, whoever is doing the cleaning, NEA will go there to supervise.
Minister Chan Chun Sing would like to say a few words.
Let me add a bit of context to the question on the impact on tourism, which Lawrence have elaborated on. Especially for the international media, I think I've said this to the local media before, the Singapore economy has been diversifying over all these years. So the tourism sector is but one of the sectors in our overall portfolio of economic activities. And within the tourism sector, we have further diversified on 2 fronts. One, we have a very diversified portfolio of tourist arrival from different countries. No one major country dominates the portfolio. That gives us resilience to the economy. The second form of diversification within the tourism industry is that we have diversified to different types of activities. So, to your question, the group tours from China will be a small part of our overall tourism portfolio, which is a small part of our overall economic portfolio. So we have a handle of the numbers that we are dealing with. We think it is manageable, and we will step up our efforts to continue to diversify our tourism activities to different markets and different types of activities. Having said that, as I've mentioned in my remarks earlier, there will certainly be an impact on the tourism industry and the related industry. There will be a wider impact on the consumer and investors' confidence that we have to deal with. And as Lawrence said, we are ready to step up the measures to support our enterprises and workers, and we have the means to it. This is one of those occasions whereby it's useful to note that over the years, we have a very prudent budget, a prudent financial management that can give us the depth of resources necessary to deal with such contingencies.
Takashi from Nikkei. Singapore government has found at least 5 falsehoods of related to Wuhan coronaviruses. And is there any specific reason that the government applied a POFMA to the only hardware zone cases?
Sorry, just to be very clear, your question is why we applied the POFMA direction only to the hardware zone case? Well, it's because that's the case that has so far emerged clearly with respect to the fact that there's a false statement of fact, which in this case, the Minister for Health has ascertained according to our current laws, and he is also satisfied that it's in the public interest to issue that correction direction. So that's why it's happened. If any others come to our attention, we will apply the same kind of evaluation and take appropriate action.
Hi, Nicholas from Yahoo. Minister Lawrence, you mentioned earlier that there's a need not to overreact or to turn xenophobic. Over in Malaysia, there's already been a petition to prohibit Chinese nationals from entering the country. Is the government concerned that such sentiments might take hold here as well? And how can it guard against that?
I think the petition is already happening in Singapore too. So it's not just in Malaysia. I mean, so we know that these sentiments may emerge. That's why we are wanting to reach out and assure Singaporeans that, look, we have in place a robust system. We have put in place measures as appropriate, and we will continue to monitor and do more if and when the situation escalates. It's a system that has multiple layers of defense. It's a robust system. But let's also be psychologically prepared. Right? It's important that people are psychologically prepared that this is not any system you put in place. Right? Given the nature of the virus, it will spread. We are trying to do our best to contain it and minimize the imported cases. But even at the start, we already forewarned and asked Singaporeans to be psychologically prepared that it would be a matter of time before we see the first imported case, which has happened, given that we are a transport hub, given the nature of air travel today. It will spread to not just Singapore, but other countries that it has already done. So I think we ought to have that mindset, be prepared that this thing may worsen, but also have the assurance that if we continue to stay united, work together with the measures that the government has and will continue to put in place, with individuals taking social responsibility for their actions and their own health, we can overcome this crisis situation.
Can I just say something? Imagine at the height of SARS and we were affected quite badly. Imagine it at that time, other countries say, get Singaporeans out of our country, and we become a target as well, right? So we are international hub. We can well be quite hard hit by such epidemics. So I would say, do not do unto others what you don't want others to do unto you. I think we all must tackle the problem objectively and effectively.
I think it's important for us to ensure that our measures that we introduce are appropriate to the situation. And I also should remind all of us that each country situation is very different. And so different countries may adopt different measures, but they all adopt measures that are appropriate to themselves. And we are monitoring the situation very closely to ensure that our measures are up to date. And we also take reference from recommendations and guidelines from the World Health Organization. So I think all these factors are taken into account when we decide on what measures to introduce. We have to guard against overreaction, and that will result in the more serious consequences. So I think it is important for us to always bear in mind that we must be appropriate to the current situation. And of course, as the situation evolves, we will need to continue to review and monitor carefully, and we may adjust our posture from time to time. The lady behind here.
Thank you, sir. My name is Siti from Kyodo News, Japan. So just now, earlier on, Minister Lawrence Wong was mentioning about extending discouraging people going non-essential travel to the rest of China. So I'd like to know, because in Japan, the government has established 4 levels of, 4 levels are multi-level. So there are certain zones which are more dangerous that we should not go, but others are less dangerous. So China is a very big place. And you mentioned just now that we shouldn't be like xenophobic, I think. So do you plan to have multi-level, which level is less which area is less dangerous? Sorry.
We already have a multi-level travel advisory, so we say avoid travel to Wuhan province, Hubei province. All right. So it started from Wuhan city, and then after that we said avoid travel to the entire province, and then for the rest of China, we say it's defer non-essential travel. right? So it's in a way tiered.
Hi, Haziq from CNA Digital. Can we get an update on the 66 of the who have been identified as close contacts of the confirmed cases? You know, where have they been quarantined? Who are monitoring them? Are they at home or in the government-run facilities and all that kind of thing?
They are quarantined at the different facilities. Some are at home quarantine. Some are quarantined at NCID, our National Center for Infectious Diseases. Some are quarantined at the hospitals. Some are quarantined at our government-run quarantine facilities. So there's a mix of facilities, and it will be appropriate again to the situation of the close contacts. If the close contacts are ill, they'll be in the hospitals to be monitored, to be treated for whatever illness they may have. And those who are close contacts which are well, they may be in the quarantine facilities. And those who have facilities at home, they are able to quarantine them. We have quarantine at home. Yeah, so as I said, some of them may be symptomatic, so they will be in the hospital, and some will be in the NCID, including those confirmed cases. They are in the NCID as well. Some of them are in the NCID.
Hi, Andrew from Mothership. So I was just wondering about the students who have been asked to evacuate their hostels at universities. Do we know how many have been affected, and what are the arrangements being made for international students with no alternative places to stay? Thanks.
Yeah, I was waiting for that question. If not, I'm going to ask it myself. We talk about just now our state of readiness. And part of the readiness is actually getting the facilities ready for quarantine. And so the education system also is also a contributor to part of this national plan. So for our IHLs, particularly universities, there are three hostels who are designated what we call GQF, Government Quarantine Facilities. So the three, one at NUS, Prince George's Park Residences, NTU is the Hall 1, SMU is Block 83 at Prinsep Street. So I know there has been some chatter because the students have been asked to move out of those hostels while it gets cleaned up and become ready as a quarantine facilities. So I apologize to the students for the inconvenience. I seek their understanding. This is part of our national response. I think for the national response, as part of this national response, we just want to get the facilities ready. We hope it wouldn't happen, but should there be more contact tracing, more confirmed cases, there will be more contact tracing, and we will need the facilities. So it's better now, before it happens, hopefully it wouldn't happen, that we get the facilities ready. Yeah. There are a few more other hostels that are affected. I think MOE will separately announce them so that the students will be informed. So for the students, I don't have the number of how many are affected, but essentially for the foreign students who don't have a home here, they will continue to stay in the hostels. As for the Singapore students, we will encourage them to go home, to stay home during this period while we get the facilities ready. Yeah.
Sorry, so they were saying the hostels that they've been asked to leave, or they will be moved to different hostels?
Oh, sorry, they'll be moved to a different hostel. So I should elaborate, sorry. For NUS, NTU, there are enough hostel facilities to accommodate the rest of the Singapore students. For SMU, hostel facilities are limited, so they'll be asked to go home. And SMU is in the city center, so I hope it will not pose too much of an inconvenience. But appreciate them, all our students, for doing their part in this national response.
Right, I just want to clarify. So for the three hostels that have been designated as quarantine zones, how many people can they accommodate? And how many potential people being quarantined is the government planning for?
I don't have the numbers. Anybody have the numbers?
These are not quarantine zones, they are quarantine facilities. We are getting them ready, and I don't think it's a question of what numbers we have today, because as we have a contingency plan, we have drawer plans. We are already activating some to stand by. And if need be, we will activate more. We will ensure whatever it takes, right? If the numbers go up, we will have sufficient quarantine facilities to contain the situation.
Minister Chan, you keep talking about providing help to entities and to the economy. Could you give some details of what are you thinking about? When will they kick in? And then specifically to the taxi drivers who drove these people to the hospitals. 2 weeks quarantine means half a month's income that they will lose because of this. So could you talk about that? And then I have a second question to either Minister Gan or Minister Wong. Compared to SARS, right? How big is the problem? How well prepared are we compared to SARS?
Okay, let me take the first two parts of your question first. Some of the measures that we can take are publicly available, like as in the SARS situation. So, for example, we are looking at, for the tourism-related industries, some of the measures that we can take and we have taken previously include, for example, property tax rebate, reduction in the foreign workers levy for unskilled workers, the easing of the working capital through a temporary bridging loan. So all this will help to reduce the risk of the business being insolvent and leading to retrenchments. On the other hand, with the slower pace of the activities in some of those selected sectors, we can also take the opportunity to step up our training for the people involved in those sectors. Another example would be for the transport sector, we could reduce the business cost to the rebates on the taxes, fees, and dues for the transport sector. And this we will all study in detail. In fact, we have started work with the respective trade associations and chambers. Now, why we have not given a specific number yet is because of the following reasons. Number one, it depends on the severity of the situation. Now, every crisis is a bit different. So while SARS, haze, all this gives us certain baseline, it is not a template. It is a baseline upon which we can build on. The second thing I think we have to be aware is the second unknown that we have to be aware is the length of this crisis. For SARS, at the depth of the crisis, it was a very intense 3 months. Then after that, we were able to clear it. For this particular situation, we are still at the early stage of the development, and it will be premature for us to prejudge how long this will take. But I'm confident that working together with the TACs and the labour movement, we have the means to understand the depth of the impact and then to put in the necessary measures. Right. Just want to, perhaps my colleagues can talk about this and the medical professionals can add. You mentioned about taxi drivers. I don't want to scare everybody. We make a distinction between, in our policy response, we make a distinction between those with regular impact, what we call high-touch events, and versus those with transient one. I think we don't want to swing to the other extreme whereby we start to fear even transient contact. So we have a risk management matrix, and it's really a spectrum of activities. But if any of the taxi drivers in the event, in the unfortunate event whereby they are afflicted by this, or we will work together with the National Taxi Drivers Association, NTA, or the Private Hires Associations to render them the necessary measures together with the respective companies. So we are in talks with the companies, we are in talks with the unions and associations. So these are early days, but I want to reassure Singaporeans that our mechanisms are in place for us to kick in these measures as necessary.
Wait, the taxi drivers are not quarantined?
No. Okay, which taxi driver are you referring to?
The ones who took the confirmed cases to the hospitals.
Okay, they are staying back in the home, right? If I correct. What's the latest on that particular incident that Salma is referring to? That particular taxi driver. We'll give you the details. Yeah.
Our assessment is that travel within taxis and MRT stations, in fact, is associated with very low risk of transmission. But nonetheless, given that there were confirmed cases that traveled by these transports, our concern is in fact to protect the taxi drivers because of their being in that environment and their continued exposure to many passengers coming in. Singaporean taxi drivers were affected by our quarantine measures, in fact, are quarantined at home. At this point in time, those who are on home quarantine remain on active surveillance.
So no income for 2 weeks, right? They can't go out and drive.
So this one will work through the National Taxi Drivers Associations and the taxi companies to render help as necessary. We fully understand and empathize with the situation.
Maybe Minister Ng Chee Meng will say something.
Well, not much to add except that, yeah, the driver is quarantined at home. Family is supporting him, and we're working with the companies for some of the relief measures that you mentioned about. Not policy yet.
So on the other questions that Salma asked, how big is this problem compared to SARS? The answer is it's still too early to tell at this stage of the virus outbreak. The medical experts tell us, as of now, that the virus is not as infectious as SARS. Fatality rates is lower, as of now. But the situation is evolving so quickly. And as you all heard from the Chinese health authorities yesterday, it is getting stronger. The virus is getting stronger. The number of infections are likely to rise. So I think we just have to be psychologically prepared that this can get worse than SARS. Not to mention the latest, some of you asked, what if there is a risk of infection spreading even before symptoms show, right? If that were to happen, I think the spread of the virus would be much faster. And because we are unable to identify and isolate, unlike SARS, which we had the means to because of the symptoms. Right? So there are many imponderables. There are many uncertainties, and we have to be prepared that things may worsen, that there will be more cases overseas, in China, overseas, elsewhere, other countries, including in Singapore. And as I said, be psychologically prepared that this may take some time to unravel, but be assured too that we have a system in place. And this goes to your second question, how prepared are we compared to SARS? We are better prepared. Because of SARS, we have learned the lessons of SARS. We have put in place inter-ministry coordination mechanisms. We have put in place drawer plans for a full range of different scenarios of the virus outbreak. And that's why we are confident in saying that we are better prepared, and we want to assure Singaporeans that we are, and that's why our message is keep calm, carry on with your lives, but all of us work together, take the necessary precautions, and we can overcome this together.
Maybe a last question.
Hello, my name is Sharanya. I'm from the Business Times. I would like to ask what steps is Singapore taking in terms of enhancing our treatment and testing capabilities for the virus? And specifically, are there any collaborations with private hospitals or pharmaceutical companies and also manufacturers of facial masks? Thank you.
Maybe Kenneth can talk about our collaboration in terms of the research on the professional side. And what's your last question?
Also pharmaceutical companies and also the facial mask manufacturers.
Okay. On the mask, Minister Chan Chun Sing will elaborate on our collaboration with the manufacturers.
We're actually having very close collaboration with many stakeholders with a view towards tweaking, ramping up and enhancing our test capabilities for this particular infection. And in fact, that collaboration extends on into also multiple different products, test kits. We continue to work with them towards validating their test kits and seeing how we can, in fact, then use these capabilities to enhance our hospital and health services ability then to detect, screen, and confirm the presence of such infection. This is an ongoing collaboration and partnership. It's in fact an ongoing piece of discussion at this time.
Maybe beyond the facial mask, let me just explain a bit on the wider supply chains resilience that we have put in place and are continuing to look in to strengthen. First of all, this is a crisis which is not just happening in Singapore, it's worldwide. So as per any of this crisis, we expect that everybody will be scrambling for supplies to make sure that they can take care of their own population. Now, over the years, from our experience with SARS, haze, and other situations, we have adopted the following posture. Number one, we make sure that in country, we have the necessary stockpile. And at this point in time, I want to emphasize this. We do have the necessary stockpiles for the coming weeks and months, provided our people all work together and do not hoard the supplies. And this is very important. We should give priority to those people that need it most and not to hoard the supplies. So there is the stockpile strategy internally. The second thing that we have done over the years, and in fact I was in conversations with ESG and also Ntuc Fair Price up to late last night, was to continue to diversify our sources of supplies. So the supplies of our masks come from a few countries, and besides China, we have also sources of supplies from other countries, and we are working with these suppliers to bring in fresh supplies. And of course, we understand in such a situation, China itself would also be asking the other suppliers to up their supply as well. So ESG, Ntuc Fair Price, and other agencies, we are working with our respective suppliers to see how we can strengthen the supply chains with them. But at this point in time, we have diversified our supply chains, and that gives us greater confidence than what we had when we were facing SARS and the previous haze episodes to diversify this. Now, having said this, perhaps just to bring the threads together about the supply chain and what Sama asked just now. In any of these crises that we are handling, we are not dealing with just the here and now. In fact, I must say that over the last 1 week when the HCG and the task forces have been set up, I'm very proud that the officers and staff from the various agencies are constantly thinking about the situation, the what if, 2-3 steps down the road, and putting in place the measures and the contingency measures as necessary. So whether is it quarantine facilities, there is a step-up plan, if you like. So it's not that these are the only facilities that we have. We always ask ourselves, if this is used up, what is the next line of defense and what's the next line of defense? And that is the way that we need to approach crisis management. It is not to go in and say that this is our plan and we will execute it. But this is a baseline, a basis for us to work on. Beyond that, how do we continue to build on layers upon layers of our defense, as what Lawrence have mentioned? So for the supply chain, it's not just only about masks, it's also about our medical supplies and the rest of the other supplies that we must make sure that we have a stockpile strategy, we have a source diversification strategy, and we continue to work closely with the producers to ramp up the supplies and secure those supplies as necessary. And the fact that Singapore is an international hub help us to do many of these things. But we must never be complacent, and we must always think about every aspect that can happen 2-3 steps down the road ahead of the situation and take the measures as necessary before the event actually happens. Thank you very much.